and welcome to Mississippi Insight. I'm Byron Brown. We have a lot to cover this morning on a critical topic for Mississippians: how to keep our hospital system intact, solvent, and responsive to community needs.
What we are doing today will result in a new investment of about $700 million for our hospitals.
Governor Tate Reeves attempts to counter the Medicaid expansion argument with Medicaid reimbursement reforms, but some of the reactions suggest the debate over expansion is far from over as the general election for governor looms large.
One of the key components of this is that this offers nothing to help cover the low wage earners in the state of Mississippi.
And this all comes as the Board of Mississippi Hospital Association fires its longtime chief as the governor made his announcement. We'll hear from him in a one-on-one interview with 12 News' Richard Lake. That's all ahead and more this Sunday on Mississippi Insight. Let's start by recapping a very busy end of the week on the healthcare policy and politics beats. With 47 days until the November 7th election, Governor Tate Reeves stood with hospital executives and Medicaid leaders Thursday and unveiled a plan for Medicaid reimbursement reforms. The governor said that the reforms are projected to generate about $700 million for hospitals across the state. Mississippi Democrats quickly panned the announcement and accused the Republican incumbent of not truly caring about working families. And Tim Moore of the Mississippi Hospital Association talked about reforms on his last day on the job as president and CEO. He noted that state leaders had rejected reforms proposed by MHA as late as last year. We're going to play excerpts this morning from Governor Reeves' news conference. Joining him in the background, among others, are hospital leaders and the director of Mississippi's Division of Medicaid, Drew Snyder.
The first initiative, known as the Mississippi Hospital Access Program, will provide payments to hospitals serving patients in the Mississippi Medicaid Managed Care Delivery System. With these payments, hospitals will be reimbursed on a higher level than before. The overall shift is significant. From an expected $562 million in MHAP funding in fiscal year 2024 to approximately $1.522 billion. This will occur not only in this fiscal year, but on an ongoing basis, and will provide long-term funding for Mississippi's hospitals. The second initiative will supplement Medicaid base payment rates for hospitals by reimbursing inpatient and outpatient hospital services in the fee-for-service system. This payment mechanism is calculated similarly to the one-time emergency payment of $137 million that hospitals received through the work of the Division of Medicaid in May of this year. This payment will represent an increase of an additional $137 million in fiscal year 2024. This funding will have a profound impact on the bottom line of state hospitals, both large and small. The change means approximately $66 million, or a 50% increase for the University of Mississippi Medical Center, an approximate $53 million, or 337% increase for Forest General, an almost $34 million, or approximately 233% increase for Singing River Hospital, and over $15 million, or 259% increase for Delta Regional Medical Center, approximately $10 million, or 138% increase for Greenwood LaFleur Hospital, and almost $17 million, or 213% increase for Southwest Mississippi Regional Medical Center, and over $9 million, or 208% increase for Bolivar Medical Center, and over $21 million, or 262% increase for South Central Regional Medical Center, and over $33 million, or approximately 115% increase for North Mississippi Medical Center. a nearly $17 million or 213% increase for Southwest Mississippi Regional Medical Center. The list goes on and on. We will be able to draw down increased federal funding with the formula changes. This increase in funding will not only invest nearly $700 million into our hospital system, but this will also help to improve the quality of care for those on Medicaid. The Medicaid system was built and designed to support those most in need across America. Eligible seniors in need, pregnant mothers, children, people with disabilities. That is who Medicaid was designed to serve. This increase in the reimbursement rate will help expand the opportunities for care across the state for those beneficiaries. Furthermore, these dollars will dramatically reduce the impacts of uncompensated care cost on providers. This relieves a tremendous amount of pressure on hospitals and will help place them in a more positive financial position. The next step for these changes will be consideration by the Federal Centers for Medicare and Medicaid Services. They must approve both of our submitted plans before they can go into effect. As I appreciate it, the plans have been submitted earlier today. And the work is not stopping there. I am also today calling for a renewed look at prior authorization reforms. We had a bill that went through the legislative process this year with good intentions of accomplishing this, but it included some technical problems which ultimately proved untenable. However, I'm confident we can bring everyone to the table and accomplish this reform during this legislative session. In fact, we've already brought everyone to the table and are in the process of having those conversations as we speak. This will go a long way to providing more transparency regarding the provision of prior authorization by health insurance companies. This is yet another way we can improve the existing health care system in Mississippi. We're also committed to continuing this conversation that got us to this $700 million for hospitals in just the last several months. I also think it's important to note that today's actions build on a string of reforms over the last several years. Over the course of my tenure as governor, we have constantly looked for solutions to Mississippi's pressing health concerns. We've met with hospitals and doctors. We've met with insurance experts, and we've met with community leaders. In fact, during 2020 and 2021, many of the same people on this that are standing behind me probably wished that they'd had an opportunity to not have to talk to me so much, but because of the pandemic, we had to come together and work to treat those in need.
Governor, obviously there's a lot of we are very close to the general election. Your response to why now, and if you're concerned that this will look like a political move?
Yeah, well, look, the fact of the matter is I've been governor now for 3.5 years. Every time I get up here, I get criticized by somebody or some group. And every time that I get criticized, I tell all of you and I tell the people of our state, we're up here today because this is what's best for the people of Mississippi. This has been a joint effort of a lot of really smart people over the last several months, and I'm proud of the work that they have done. The fact is, I was elected governor of this state in November of 2019. This is governing. This is bringing people together to find solutions to challenges that meet us. At the end of the day, that's what this is. As I went through earlier and told you, this is yet but the next step in the things that we have done over a large number of years to help improve things, starting since I became governor, at least, with the work that we did with the hospitals in moving patients around. Dr. Clay Hayes certainly stepped up during that time and worked with each of these hospitals to make sure that the patients that needed to be in certain facilities were moved where the capacity was available, so that we ensured that every single Mississippian that could get treated and get better did so. The work that we've done working together again included a $130 million supplemental payment that was approved by the Division of Medicaid in May. It includes the $103 million program that was enacted in the Mississippi legislative session between January and March of this year. And today is yet but another step in the process of always working to make Mississippi better. I'm going to get criticized no matter what I do. That's the reality of it. Since I've been elected in this state, I've committed to doing what I think is right, and I'll let the politics play out however they choose to play out. But I believe that this is the right thing to do, and I think the numbers bear this out.
What's the timeline for CMS consideration on this?
Drew, you want to address that?
Emily, we can't give an exact timetable, but I will say that we got approval for the original MHAP for state fiscal year 2024 in about 2 months. Last year, when we had an amendment, it took about 3. The federal government works at their own pace, but that is some historical perspective for you.
Drew, can you speak to? It is my understanding that our request to CMS makes this retroactive?
That's correct.
To July 1.
When it's approved, it'll go back to July 1, 2023.
Yes. Drew, if it's possible, Mr. Snyder, could we maybe sit down at some point and talk through some of these changes just to make sure we understand the details? Just wanted to see if that's possible.
I mean, I don't know, but he looks excited to do that to me. Hey, thank you all very much for being here. Y'all have a great afternoon, and thanks for what you do.
That's Governor Tate Reeves speaking Thursday at the Sillars Building. In a moment, our Richard Lake breaks down some of the reaction to the announcement. It's Mississippi Insight only on WJTV. Mississippi Democrats have been eager to campaign on health care reforms such as Medicaid expansion as the general election approaches. So it's not a surprise that they would blast the governor Thursday for declining Medicaid expansion. Reeves' opponent in November, Democratic nominee Brandon Presley, posted this statement saying, quote, "If Tate Reeves really cared about ending the hospital closure crisis he created, he would call a special session and expand Medicaid so working families can get the health care they need." Also commenting to reporters Thursday, Democratic Party Chairman Chuck Taylor.
In some parts of this state, you can die because of a bee sting because you're not close enough to an emergency room. And he's been very public in stating that we're going to have to get used to that idea. I think as Mississippians, we deserve more. That's why I'm encouraging all the listeners to not only vote Democrat, but also vote for Brandon Presley, who says he will actually expand Medicaid day one on the job.
Do you have a concern that this is addressing the hospital financial piece, but not the uninsured Mississippi?
Well, and again, that's because it's being thrown together at the last minute. Polls are showing that almost 80%, almost 85% of Mississippians saying that the right thing to do is Medicaid expansion. But to resist that, we'll say, hey, listen, let's come up with these pre-contrived and things that I've actually vetoed in the past, saying that now they're relevant. But less than 46 days until election, this won't fly and won't work for the state of Mississippi.
What do you think about the fact that the governor is rolling out this plan just a couple weeks after Representative Jason White, the incoming speaker, signaled that he's open to expanding Medicaid? And just today, the governor signaled that no, we're not into that still. Is he facing pressure from his party too, in addition to pressure?
I don't know. As a Democrat, we have not been privy to those conversations. And in my opinion, that's why the supermajority is so necessary, so you could continue to pass bad legislation.
12 News senior political correspondent Richard Lake spoke with the now former head of the Mississippi Hospital Association Friday. It was Tim Moore's last day on the job. My colleague Melanie Christopher and I spoke with Richard about that and other reactions to the governor's reform plan.
I enjoyed my time at the MHA and supporting hospitals, and I'm sure I will still do that in some form or fashion.
Absolutely. And can you tell me who will be filling in the interim?
Kim Hoover is the chief operating officer at the association, and she will be filling the vacancy until a search is completed.
Okay. And we were talking about timing earlier. The timing of this. Can you tell me anything about when this was discussed? I know the endorsement to Commissioner Presley didn't go over well with some people. Do you think that had any decision in the matter?
That would be a question for the chairman of the board. I'll have to decline. I'll just say that our discussion started after the contribution.
Moore says while he is appreciative of this investment, it leaves out an underserved portion of the population.
One of the key components to this is that this offers nothing to help cover the low wage earners in the state of Mississippi that don't have discretionary income to pay for health care or even to pay for health insurance. So that's where it will fall short in what the state needs. So I appreciate the governor saying that this is just one of many steps. I'm hopeful that the next step will be moving closer to some type of additional or added covered lives.
MHA has not specified why Moore was relieved of his position.
And Richard, how have the hospitals said, what have they said about this investment and what it will do?
Yeah, they're very appreciative. One hospital executive actually went as far as saying that this is the most significant investment to ever come out of the state division of Medicaid. Now, Dr. Lou Ann Woodward, Vice Chancellor for Health Affairs at UMMC, said, quote, "I am grateful for efforts to ensure hospitals in our state receive funds that adequately reimburse them for the services they provide." An interim CEO of Greenwood LaFleur Hospital, Gary Marchand, said, quote, "Once approved, these programs will reduce or eliminate the underpayments experienced by Greenwood LaFleur Hospital when caring for residents with Medicaid coverage and the uninsured." Meantime, Dave Estorge with St. Dominic Hospital in Jackson had a stellar opinion of the reforms.
This might be the most significant event since that establishment of the agency happened. Whether it's rising labor costs, rising supply costs, challenges in retaining nurses and physicians and recruiting physicians to the area. Honestly, some of us were just kind of wondering, how are we going to get through this? This is not just a lifeline. This is going to allow a lot of hospitals an opportunity to take a deep breath.
This plan must first be approved by the Centers for Medicare and Medicaid Services, and former MHA President Tim Moore believes that approval will come anywhere from 6 to 8 months now, while Estorge is hopeful that it will come from 30 to 45 days from now.
A lot more to all of this,
So much
certainly
more.
a lot more to learn. All right, Richard Lake, thank you.
In other election news, a second Hinds County Supervisor has begun the process of challenging their primary election results. Richard Lake has more on District 4 Supervisor Vern Gavin's allegations.
Hinds County District 4 Supervisor Vern Gavin is contesting his Democratic primary loss to opponent Wanda Evers. Gavin alleges poll workers and members of the Evers campaign violated Mississippi election law on Election Day.
Voters complained of undue influence by poll watchers and were told who to vote for. Campaign workers were about 30 feet from the polling place. The law requires a distance of 150 feet.
And that Evers herself did not meet residency requirements. Documents provided by Supervisor Gavin's campaign suggest that Evers filed for a homestead exemption outside of District 4 while claiming residency at a Clinton home inside District 4.
Ms. Evers cannot claim residency at a duplex house at 1624B Rosemont Drive in Clinton, Mississippi, and take homestead exemption at 2908 Hemingway Circle in Jackson, Mississippi.
12 News cannot independently verify the documents provided by the Gavin campaign due to the ongoing Hinds County computer system outage. In a statement, Evers did not acknowledge the residency claims, but said in part, quote, "We have not officially been served with any type of official documentation. It would be premature for us to discuss this matter before we are in receipt of anything official. We look forward to winning for a third time November 7th and serving the citizens of Hinds County." Evers is set to take on the Republican candidate for District 4 Hinds County Supervisor, Allison Lauderdale, in the general election. Reporting in Jackson, Richard Lake, 12 News.
We'll be right back. If you have comments or questions about today's show or a suggestion for an interview or a segment, just drop us a line. Email our producers. The address is news@wjtv.com. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown from all of us here at 12 News. Make it a great weekend.